Welcome back to another episode of the Patient No Longer podcast, where our goal is to humanize healthcare. I have a fantastic guest today. I'm joined by Jason Brown. Hello, Jason.
Good morning.
Well, it's great to have you with us. Jason is a big deal. He's a CEO and Chief Strategy Officer of a marketing services firm called BPD. They are exclusively in healthcare. They work on projects all over the country. They're focused on brand strategy, purpose-driven marketing, collaborating with many health systems across the country, and we'll get into that. You've also been recognized, BPD, as a firm by Forbes that is one of the best companies to work for in the country. So congratulations on that. I want to dig right in, Jason. You know consumers, you know how to connect with them, how to build brands, and how to market. We're in 2023. Where are consumers in terms of their connection to healthcare or their lack of connection as we emerge from COVID?
Well, I think that there was a transformation that happened during COVID. I know it's probably an overused phrase a little bit, but consumers learned how to find healthcare for themselves, more so than ever. So a lot of DIY going on during COVID, accessing healthcare when, where, and how they wanted it. And the companies and the brands that are able to keep up are going to thrive moving forward. Having said that, I think that they're in all different states. You know, some are more lost than ever, feeling more disconnected from their healthcare than ever, and others are that found those connections, those brands, those organizations that they're able to get what they want out of healthcare are in a better place. So it's an array of different states, but there's a lot of opportunity out there for really smart, savvy healthcare providers.
I like the way you say array, and I think in our data at NRC Health, we have a third of the country that is not coming back to healthcare. They are saying that I have necessary medical treatment I should seek, and I'm not doing it. Now, the reasons are sometimes around money, still a little bit of COVID, a little bit of lack of familiarity, but then you have other people who've sort of reemerged and they've gone back to the doctor and they've said, okay, I'm back in the rhythm that I was in, but it doesn't quite feel like before. What would you say to organizations who are maybe not seeing that return of patient volume or that utilization that they thought? Because I think a lot of us thought, okay, people are coming back, let's go, let's resume. And it's not quite happening. With those organizations, is there advice or perspective you would give them about how to deal with that?
Yeah, I will say, now, again, we're a marketing services firm and we're leaders in our space. So we have a certain point of view on the world, right? But I will tell you in our experience, the conversations that happen is typically what we see is that their brand is deficient in a couple different ways and that they need to work on it. First and foremost, before anything gets done, before you try to convince people to come back and re-engage with healthcare in the right way, you actually have to have people answer the phone. You have to have people that can actually treat patients. So building their employer brands has become a really big part of our business and helping them rebuild their employer brands. Some really exciting work is going on in that space. But once they have the people and they have the systems and what we call operational fidelity, then of course you have to go out there in the general sense and convince people to re-engage in healthcare, to take care of themselves, to seek preventative care, and certainly when they have some type of illness to re-engage. So those are two different types of brand work streams that we are typically engaged on. And it's really exciting and really necessary piece of the business right now.
I'm glad you brought up employer brand because I feel like that's part of what's missing. And some of the comments we see from patients returning to care is that the workforce, the staff, the people in front of them, the humans, were not what they expected. So you talked about brand deficiencies. Is deficiencies in workforce, or at least how they sort of present the brand internally, is that a common deficiency you see across the country? Or do you see other things that sort of play into the deficiency mix?
Yeah, I hate to admit it, but I would say in 90% plus of organizations, there's some level of deficiency. Now, there's different, levels.
Sure.
But healthcare systems historically have been built around the needs of the physician. There's nothing wrong with that. It's just a legacy within healthcare that we all live with today. That has made them basically policy-driven cultures. Now, the organizations, and there are many out there that have pivoted to people-driven cultures. Those are the ones that are having an easier time pivoting in today's modern world and having an easier time adjusting and gaining greater traction more quickly. The organizations that are sort of caught in the middle, they're like, God, we're legacy, we are policy driven, we recognize that, we see the issue, and we want to get over here to the people driven culture to be able to have much more success in today's modern healthcare landscape. Those are the ones that we're typically working with, right? So they haven't gotten there yet, but they have the aspiration, they have the desire, and candidly, they have the will, and they'll put the resources behind it. It's just a journey, though. It's hard moving. They're like aircraft carriers. These are not, small speedboats. So it's an exciting time, actually, in healthcare.
I agree with you. I want to dig in on that more. I once heard a phrasing from Ken Kaufman of Kaufman Hall that I'll never forget. He said, healthcare has always been customer-centric. It's just for decades the customer was the physician. Right. And now we're trying to deal with our own employees and, of course, our patients and consumers out in the community observing our brand. So I think that that's something that's so true you talk about. But also, while we're on workforce, we have to address the Great Resignation. So this huge break, people all leaving their jobs in 21 and 22. We talked about that a lot, from burnout and turnover and just all of the energy needed to replace. And then, of course, rising salaries and cost. But what about the employer brand? Did that take a big hit during Great Resignation? Is it recovering in your opinion? Where do we stand with employer brands?
I think it's very organizational specific, to be candid. I will tell you that it has hit healthcare as hard, probably if not harder, than any other industry. I mean, at first there was great momentum within the healthcare space because, we were singing from rooftops for people going to their job and saving lives every day. And that quickly turned into, and we won't cover politics in this session unless that's something you really want to get into, but it quickly turned into something else. And that really affected healthcare workers who felt underappreciated, perhaps within their organization, but also within the community at large. So it really started with the community, and then they, of course, pivot back to, is my organization doing enough for me? There's the other part of it, though, as well. So just as part of like a general trend, I have lots of friends that are nurses, for example. I have friends that are doctors, but this is really a nurse-specific thing. Nurses are pretty mobile and pretty desired in the marketplace. So if you're a nurse that could either work virtually, you see your friend went and got a job and she's working virtually, or they're working in a setting that is so much less stressful and pays you more, there's going to be some issues there. So hospitals and healthcare systems, again, this brand used to be a very dirty word within their world. If you talked about brand, they'd be like, that's the stuff, that's the money that I spend where it doesn't drive us volumes. And it's not really true, but that was the rap on brand for many, many years. And to a certain degree, it still is. The truth of the matter is that CEOs, the C-suite of healthcare systems are waking up today, and they woke up, actually it was more like a year and a half ago,
sure,
saying, how strong is our employer brand? And how strong are we actually communicating our brand out there to the world at large? And I bring all this up because the question is really about, what is going on within hospitals and healthcare systems, and they are reinvesting back into employer brand today like they never have in the past, because they realize if we're not good at this, we don't have people to take care of our patients anymore. And it is a major issue. The nursing shortage and the physician shortage in this country is predicted to go on well past my days on this earth.
I agree with you. I don't think there's going to be any fix to that soon. And it's so interesting, the brand perception. I completely have observed that as well, of people saying, my brand was sort of a set it and forget it situation. And maybe we'd revisit every 8 to 10 years and bring in a firm like BPD to look at it. But when you had nurses themselves who were feeling like at first they were celebrated and there was yard signs, so we can talk about it.
Yeah.
And then, I talked to a nurse who said, I'm afraid to go to Walgreens in my scrubs. And so I change out of them. And so you just have this incredible dichotomy of perceptions. And I think ultimately what a lot of leaders are doing is saying, where is my brand now? I mean, do I have stains that I can't wash off? Am I doing okay? I need to at least assess it. So let's go back to brand. And one thing in particular that I've found you talk about, and I think is very interesting, is just this journey you talk about towards brand affinity. Tell me more about that journey. And for people who don't know brand inside out, what is brand affinity?
Well, it's simply saying that, think of the brands that you work with every day, or that you buy on a personal level. So I love Amazon, just for an example. I don't even buy that much stuff on Amazon, but I know that if I want to get something by like 3 o'clock this afternoon and they'll have it drop shipped to my house, that's where I want to go. And it's such like an amazing experience. So I would much rather do that than go to my local drugstore, deal with people that don't really want to help me whatsoever, search up and down the aisles. It takes time, energy, effort, and it's not even a very good experience. So I have an affinity towards going to Amazon for whatever my needs are. That's one of many brands where I have an affinity towards. And affinity is just basically what it says, which is I prefer to do business with, or I prefer to interact. I prefer to have that brand be a part of my life. And it's very hard to create affinity. It's very easy to lose it.
It's so interesting, too, because I had a similar situation with Southwest Airlines. I would actually talk about them on the podiums and sort of extol the virtues of Southwest. And then my first trip coming back from COVID, hadn't been on a plane 16 months. It was beautiful. And I got on there and I was excited to fly again. And we went as a family and they lost 7 of our 8 bags. Yep. And it was like immediately all those things I remember that I hate about travel were back. I'm glad that you brought up, favorite brands and those sort of things. You don't know this, Jason, but we're introducing a new feature of the Patient No Longer podcast, and that is a speed round.
All right.
So to break up the conversation, take a little.
Is this number 1 speed round? Is this the first ever speed round?
This is the first speed round, yeah.
So we're making history in a way.
We're making history, and I'd like to ask everyone to have low expectations since it's the first.
Is that because of the guest or is that because of the questions?
No, you've inspired me. Okay. We'll say it's you. And it's only a few questions, but just to break up the healthcare conversation, it's fun to take a little break from healthcare. So I'm going to ask you these, and I ask you just top of mind answers here. It's like market research.
All right.
Okay, Jason. Coke or Pepsi?
Coke.
No hesitation there. Fiction or nonfiction?
Nonfiction.
Nonfiction. All right. Are you a morning person or a night owl?
Neither.
Your perfect day is wake up at noon and in bed by 6. I'm with you. Favorite television show of all time?
I love The West Wing and Modern Family.
Sure.
And I have like 10 others if you give me more time.
No, just one. Okay. No, that's perfect. Okay. And then last one, Boston or New York?
New York. But I love Boston, just for the record.
For the record, we are recording this in Boston, so ouch. Okay, well, let's try to recover from that. No, teasing you. Let's go back to, so you were talking about brands. Let's get back to sort of consumers and how to reach them. And this is a age-old question that I think a lot of strategy firms and marketing firms wrestle with, at least with their clients. So I want to pick your brain on this. Data versus creative. And I think some people are listening to this picturing data folks and picturing creative folks, and they don't always look the same. But what is the right mix, and how do you handle projects where there's tension between what's the right amount of data to use, and do we just trust our instincts and go creative?
Yeah, so BPD today, I'm going to bring it back to our company for a moment here, because it's probably the best example on how to answer your question in short. BPD today is the largest hospital and health system marketing company in the country. I truly believe if there's a list of 3 reasons why,
sure,
I would say in those top 3 reasons, whether it's 1, 2, or 3, I couldn't tell you which one it is we are able to use and leverage data that is not only more powerful than anybody else has access to, but we're able to leverage it in ways that are more powerful. And so the answer to your question from where I sit is it's never going to be an either or. Data inspires and should inspire on its best day, great strategies, and then of course, great expressions of the strategy, which is creative, which is how you asked the question. So to me, it's both, but it starts with great data, starts with great insights. If you could have unique data that nobody else has access to, and or you're able to interpret that data in more powerful ways and then act upon that data, that is the right formula. And whether it's within our walls or anybody else, I would recommend the same to them.
I love your answer in terms of powerful data, because data is not all created equal. In fact, we had a recent guest, Brandon Jones of Crillion Clinic, who talked about how it's really important that you frame the data, and in framing it, you use the right amount. I mean, if you just give people scads of data, they're just, they get overloaded, and sometimes we make decisions in the wrong way. So I really love that answer. Let me put it in the context of 2023 and post-COVID, or at least what I'm going to call post-COVID. So we're going to will it to be. Is advertising and just marketing in general to consumers more difficult now than, say, it was in 2019?
Well, If you phrase the question, is it harder, more difficult in 2023 versus 2013? If you take a longer period of time,
Sure.
the answer is unequivocally yes. Having said that, it's much more rewarding. In other words, in the healthcare field, especially within hospitals and healthcare systems where I sit, the bar has been raised. Our clients no longer are okay with, we'll give you $1, you give us back $3. As a matter of fact, they would, 10 years ago, they'd be like, that's great, you got us 3-to-1 return, we're all good. Today, the conversations we have are about, we'll invest $1 with you, can we get 10, 15, or 20 back? And that's how you really regain volumes. That's how you really get back to the new normal post-COVID in their world. They have to have marketing investments that are far more effective. Now, the question was, is it different? Is it more difficult?
Sure.
I think it's much more difficult to get there, but that's why I run a subspecialty firm, right? Because I think that you have to work with partners, whether it's internally and building your teams, or with external partners like a BPD that really know their stuff, that understand the industry inside and out. So in the old days, you could just have people that came from any industry, anyhow. The truth of the matter is today, healthcare marketing, especially for hospitals and health systems, is very much a subspecialist game. You really have to know your stuff because it really is difficult.
It's incredibly complex, and the barriers to entry are huge, and I completely agree with you. And I appreciate the honesty in that it is difficult to connect with consumers. I don't think there's any easy answers there. One thing that I do want to ask you about, just specifically project-based, you're part of Hub 23, which is the new rebranded annual meeting for NRC Health, and you're going to be talking about some work with HCA. And of course, HCA is a great example of massive, right? They're huge, they're everywhere, they're very well known within branding circles in healthcare. Not every consumer knows HCA because of the way they've branded. So it's just a really interesting, great example of complexity. Tell me more about your work with them and some learnings from that maybe our listeners could benefit from.
Yeah, so I'm really looking forward to our session here. Was really honored to be invited. So let me just say that first and foremost. We've had a long-standing, long-term, very deep partnership with HCA Healthcare. What we're going to be talking about here is all about the beginning of their rebrand. So as they go around the country, I mean, if they have 180 acute care facilities and they have hundreds more in other types of settings, historically, there's been a lot of different ways that they brand themselves and a lot of different ways that they talk about themselves. Everything from how they, the logo that they have on their scrubs, all the way to their signage, to their marketing, of course, to even how they just develop their employer brand.
Which is universal, right? Not to cut you off, but I think that challenge, Jason, which you're describing for HCA, I think everybody has gone through that at some point. It's such a great plug and play.
But because they're the largest, it's the biggest challenge for them, actually, right?
It's a behemoth, yeah.
So it's been a really fascinating. So what we're going to talk about is our journey that actually has begun in Florida. Happens to be my home state, but that's just coincidental. Our journey that has begun in Florida of that rebrand, and the data that we've used in developing, as I spoke to earlier, developing the strategy and eventually the creative work, and then actually also making sure that it's all working along the way. So we've had data, they have had a long-standing partnership with NRC Health, where they have different data that they have been able to use to develop strategies, to develop actually activations, and also, of course, to monitor whether or not those strategies are landing in the marketplace. So we're really looking forward to that discussion.
That's fantastic. And I think we'll all be waiting to hear about that. And I do think that folks who are branding leaders, and that's not just marketing folks at health systems. I know a lot more C-suite folks who are getting engaged in branding. To your point earlier about branding used to be a dirty word. Now it's right there as a strategic pillar. And we love to see that. But I think a lot of people are going to be watching some of these rebrands and some of these journeys and taking their own notes. Right. And I'm curious for anyone out there listening who's saying, I wonder if our brand needs a refresh or just an assessment. What's some advice that you would give them to just get started? Because as you know, brand is a big thing, and sometimes it's not sitting in your inbox waiting for you. And so people can kick that can down the road. What's a concrete step they could take to start that process or that journey?
Yeah, I mean, before you even hire a company like a BPD, or even engage perhaps a partner like an NRC Health, I would take a look at whatever your mission, your purpose, your vision is in your organization, and do an honest self-assessment. Are we living this every day? Are we actually delivering on this? And if there's gaps, and for all of us, by the way, there's always some gaps.
Sure.
You say, okay, this is our brand journey that we have to start going on. We got to start filling these gaps. We got to improve things that we're already doing well. But areas where we're not living, where we're not actually activating against our mission, our purpose, our vision, let's go do that. Because I promise you that probably falls into the bucket of brand. At first, it should be operational, though.
Of course.
Right? It shouldn't just be like, hey, let's have a fancy new campaign. It has to be real. In order to land with your internal audiences, which is most important, and then bring it to the outside world, it has to be based on actually doing a better job at something. So actually living your brand, operationalizing your brand is what we call it.
Otherwise, you've built a beautiful shell that the patients will crack right through, and they will see right through that veneer.
Well,
as
the
they have
patients
experience.
won't even have to, you won't have to worry about the patients because your own people will see right through it.
They'll
right?
see through it.
Nothing's worse than stuff on a wall that nobody pays attention to.
Yeah.
Nothing's more powerful than stuff on a wall that everybody lives every single day.
Right.
And there's no amount of fluff that you can put around it that'll make it more powerful, but there's lots of things you can do to make it less powerful. So we work with organizations on helping them on that journey, even from the beginning.
Yeah.
And that's an important one. That makes them money. That's what really moves and transforms these organizations. And CEOs in the C-suite are starting to get that. They're starting to get, candidly, that this is a business proposition, that this isn't just a advertising campaign that we're going to do. How do we move our brand to transform our bottom line and live our mission concurrently? And that's what healthcare is all about. We all got into this for a reason, right?
Of course.
So healthcare is one of the few areas where you can actually do good and do good at the same time. Do good in the world and do well by yourself. So making money and living a purpose is, I think, a big reason we're all sitting here right now.
It is a big reason. I think that powerful line that you draw from whether it's making money but having a purpose, because one without the other doesn't always work, but also just that employer brand and that inside focus is really refreshing, because just too often you see people jump the gun and start going to colors and start going to creative when you've got to take care of your folks inside the house.
And we own some of that. The healthcare marketers, both inside health systems today, as well as some outside firms, not BPD, but I won't say that we never made this mistake in any time in our history, is you get excited about doing that stuff. Sure. It's cool, it's colorful,
Shiny.
It's up in bright lights. That's cool stuff to get to. But the truth of the matter is that unless you've done the work, it's not going to get you anywhere. And you're not really going to get a return. So having real business cases around brand and what it really is all about, all of our clients would agree with the following statement: brand is not advertising. And some of that has been perpetuated by marketing, and some of it is just we haven't educated the C-suite to tell them the difference. But that is something that we do almost every single day. We literally have decks at the ready that are like, brand does not equal any of these things in the right-hand column. And those are all advertising-related things, including their logo, their commercial. That's just not brand.
And you've done some effective campaigning. One of my first interactions with a CEO, the topic of branding came up. I was much younger, more youthful looking, and the CEO was asking some really interesting questions about brand, and I was trying to answer those, and he sort of cut me off and said, I really want to know what my business card's going to look like. So we've come a long way, Jason, from those days.
I'm glad we made some progress.
We've at least made some progress. And I'm curious, speaking of journeys, I ask this to every guest that we have on the Patient No Longer podcast, but you're walking down one of those halls. Hopefully it's inspired and those employees feel engaged to the brand. But you bump into someone on their first day of their first job in healthcare. So this is day one of their healthcare journey. Let's say you share an elevator ride with them. What's a piece of advice you would give them on day one?
To me, I think healthcare, I decided a long time ago, I wanted to be in a space where I felt like I could be making a difference in the world. And there's very few jobs, very few careers, very few journeys where it's not just a charity or a not-for-profit, and there's nothing wrong with dedicating your life to those, to those pursuits. But I thought it was a place where you could actually have a great career, be well compensated for that, and at the same time live a purpose and really, as Steve Jobs would say, put a little dent in the universe. And I hope that I look back on the last 30 years, and whenever my time is up and they kick me out of my position, that I'll feel that I did that much more so than any other personal gain that I've gotten. So that's the advice that I would give anyone. Of course, no one would ask me for that advice because I'm very long-winded and the elevator ride would have ended and they would have already gotten off. But if they did and they decided to hit the stop button, that's the advice I would give. And my son is entering the workforce now.
Oh, great.
And it's the same advice that I give him is, if you can combine purpose and profit, that's a great career.
Well, you've had some good practice then giving your son advice, and that's exciting. And yes, everyone can benefit from that advice and a lot of what you've shared today, Jason. So I want to thank you so much for joining us on the podcast.
It's been my absolute pleasure. Thank you for having me.
All right. Well, thank you. And this concludes another episode of the Patient No Longer podcast. Thanks, everyone. We'll talk to you next time.